and he's going to be talking about PRAGUE-12 trial, and it's a randomized trial comparing cardiac surgery with a special procedure, the Maze procedure, in relation to atrial fibrillation. Peter.
Good morning. Thanks for the introduction. I have the privilege to share with you, on behalf of the whole team, the results of the PRAGUE-12 trial, which was a randomized study done in 3 centers in the Czech Republic, comparing cardiac surgery with left atrial surgical ablation versus cardiac surgery without atrial ablation in patients with coronary artery disease and or valvular heart disease scheduled for elective surgery. This study will be published today online in the European Heart Journal. Surgical ablation procedure is known for many years to be able to restore sinus rhythm in patients with atrial fibrillation undergoing cardiac surgery. However, it is not clear how this helps clinically to the patients. There were only few randomized studies, and all of those randomized studies were very small, and most of them done only in patients with mitral valve disease, not in patients with coronary artery disease or with aortic valve disease. And we just postulated our hypothesis to be tested, and we put ourselves 3 questions. First, how frequently Maze restores sinus rhythm after surgery compared to no Maze? Whether this Maze procedure can could increase potentially some complication rates around cardiac surgery, because it is prolonging operation and is doing scar in the atrial walls, and whether the successful restoration of sinus rhythm may have positive impact on long-term outcomes of these patients. This is the scheme of a surgical procedure, how the surgeon is doing these ablation lines in the left atrium. This is the way how our surgeons did it. I forgot to say that I am not cardiac surgeon, I'm cardiologist. Our cardiac surgeons are sitting in the room here. And these are the main results. Sinus rhythm after 1 year as evaluated from 24-hour ECG Holter monitoring and defined as entire absence of any even short episode of atrial fibrillation at that Holter monitoring was present in 60% of patients after ablation and in 35% of patients who did not undergo ablation. So concerning sinus rhythm, the procedure was very effective compared to the control group. Concerning perioperative complications, we were afraid that the prolongation of surgery and creating scars in atrial walls could increase potentially some complications, and it was actually found in one of the previous studies, but we didn't find it, and the trend was even in the opposite direction, as you can see here. So 10% complication rate in ablation group and 14% in a group without ablation. And the long term, we planned the study for 5 years. So the results which we present today are after 1 year follow-up. So this study will be followed by 5 years, and after 4 years from now, we will see the final long-term outcomes. But the 1 year outcomes are shown here, and there was no difference in clinical outcomes after 1 year between both groups. So the conclusions are, first, surgical ablation improves the likelihood of sinus rhythm presence up to 1 year postoperatively compared to control group without ablation. Surgical ablation does not increase perioperative complication rates, so it is very safe. And there is so far no impact on 1 year clinical outcomes, but as already said, the critical will be to assess this after 5 years. Most significant rhythm benefit was observed in our patients, among patients with long-standing persistent atrial fibrillation, where there were very few patients in whom sinus rhythm occurred after 1 year without ablation, but with ablation it was in more than half of them. Thank you.